there, I'm MJ and you've dropped into One Green Voice, where ordinarily we talk about everything to do with eco-friendly lifestyle. As you can tell by the thumbnail, today's video is going to be very, very different. If you'd have told me 2 months ago that I'd be making a video about being in the hospital for a suspected heart attack, I would have thought you were absolutely nuts. But that's exactly what happened. My weight is low, I eat well, I've always been active, I have genetically low blood pressure and heart rate. So what happened? Well, like so many things do these days, this adventure started with an email. I got an email late one night that made me super angry. With hindsight, of course, I realized that I should have given it some time, probably a lot of time before I responded, but I didn't. I ended up calling the person and let's say we had a very heated conversation. Now, during this heated conversation, I was probably as angry as I've ever been in my life, and probably more angry. Several minutes into the conversation, I started to have a pain kind of in the middle of my chest. Now, if I'd ever thought I was going to have a heart attack, I always would have imagined the pain would have been on the left, over the heart. But no, it was in the middle of my chest. And after we finished the telephone call, I went to talk to my husband and realized that my left arm was now hurting. It was kind of a deep pulsing pain going all the way down my left arm. And I thought, this isn't a great combination. Within about 20 minutes, I was on my way to the hospital. The intake nurse immediately gave me 2 aspirin and told me to chew them. Quite quickly after that, I was on my way to get blood work, chest x-rays, and an ECG, which is an electrocardiogram. Within about an hour and a half, I found myself admitted to the hospital, and the nurse was telling me, as she put the IV into my arm, that I'd probably had a heart attack. I was in absolute shock. And I said all the things to her that I said to you at the beginning of the video. I said, how can I be a candidate for a heart attack? And she said, well, all we know right now is that your ECG looked fine, but there's troponin in your blood. And troponin is a protein that's found in the heart muscle. And it's not supposed to be in the blood. And if it is, it's in minute amounts. So the minute they see that, and given the description of how and why I came to the hospital, they said, you've probably had a heart attack. So the first thing they did was put me on blood thinners, because of course when you have a heart attack, the most common reason is that you have narrowing of an artery or some other kind of blockage. And they also put me on medication to lower my blood pressure and my heart rate. The next morning, I was moved from emergency into a room on the cardiac floor, still in shock and denial. And soon after that, I met with a nurse practitioner, and she explained to me that I either had a heart attack or something called Takotsubo cardiomyopathy or Takotsubo syndrome. And this happens when the body undergoes a really stressful situation, so an emotional stressor or could be a physical stressor as well. And doctors cannot tell the difference between a heart attack and a Takotsubo attack until they do an echocardiogram and an angiogram. An echocardiogram is an ultrasound of the heart, which discloses whether there's been damage to the heart. And with Takotsubo syndrome, there is damage to the heart, but it's temporary. And the heart usually what they call remodels over the next couple of months. The other indicator they need is an angiogram, which is a procedure by which the doctor can look into the arteries around the heart to see if there's any narrowing of the arteries or a blockage. But this test is quite invasive, so they don't want to do it unless they absolutely have to. The nurse told me that given my vitals and the fact situation, if the troponin in my blood was seen to be leveling off or coming down, they might get away with just doing the echocardiogram while I was on the treadmill doing a stress test. Now this sounded kind of crazy to me, but I don't know how they do an ultrasound while you're on a treadmill, but they say they can do it. I never got to experience that because unfortunately the next blood work showed that the troponin was still going up. So they said, sorry, but you're going to have the echocardiogram and then we're going to have to do an angiogram to figure out what's going on with you. Needless to say, I wasn't real happy to hear that. I learned that angiograms are a really popular procedure because I had to wait another day and a half to have one. In the meantime, they did the echocardiogram, which showed that there was some damage to my heart. And I learned this not the best way when the nurse told me just before I went in for the angiogram. She thought I already knew, but no one had told me yet. The angiogram was not fun, but it was certainly not as bad as I had anticipated. I was very fortunate that they were able to go in through my right wrist, which they froze. The other way they go in to do this test is through the groin, and that is a much more serious ordeal. As I mentioned, when they do the angiogram, the doctor is looking for any kind of blockages around the heart. If there are minor narrowings of the arteries, the doctor can put in what are called stents, which makes sure that the arteries can stay open and that the blood can continue to flow through them. If during the angiogram the doctor discovers that there are major blockages in one or more arteries, then it's not unlikely that the patient will need to go for what's called bypass surgery. In my case, fortunately, there was absolutely no evidence of heart disease, so the procedure was over quite quickly. The next morning, the nurse practitioner reappeared with the cardiologist on call, and they informed me that I'd had a Takotsubo attack and that I was going to be released. They said they were going to refer me to the cardiac rehab program. It's now 6 weeks later, I still have not heard from them because obviously there's a lineup to get in. So not much more guidance in terms of exercise than start by walking 10 minutes a day. Still don't know what I'm really supposed to be doing, but I'm taking a couple of short, slow walks a day and still doing my stretching and physio that I was doing before the incident. They also sent me home with 2 medications, an ACE inhibitor and a beta blocker, which are designed to keep the heart rate and blood pressure low, because they found that when recovering or remodeling your heart from one of these attacks, if the heart works less diligently, then it recovers faster and better. So those medications have been a challenge for me because, as I mentioned earlier, my heart rate and blood pressure are both naturally low. So even though they gave me really small doses, I eventually had to cut those small doses in half. And now I was able to start using my right arm again about the 3rd day after I got home, but I wasn't really comfortable using it for about a week. The arm was very black and blue and purple and green and you name it, and as was my left arm from the IV and all the blood work. So I'd say pain in both arms lasted about 3 weeks. The left arm recovered more quickly, and the right arm was pain-free, I'd say, after about 3 weeks completely, although I was certainly using it before then. Next step is a follow-up echocardiogram, which is going to take place. It'll be 3 months to the day from when the attack happened. And that's basically the process I went through. I debated whether I should talk about this in a video because, first of all, it has nothing to do with my channel. And second of all, it's pretty personal, but I had never heard of Takotsubo syndrome. I had, I think, heard in passing of broken heart syndrome, but I didn't know what it was. They are the same thing. But I thought I should put this out there so that, maybe somebody else can learn from it. Certainly, if you're in the middle of a situation like I was, where you're, acting like something out of The Exorcist and your chest starts to hurt and then your arm starts to hurt, it could be Takotsubo. But you must always, always go and get checked out. Go to the ER because you don't know what's happening. You just don't know until they do the testing. So who gets Takotsubo syndrome? Well, lucky us. It's most likely to be menopausal women over the age of 50 with an increased likelihood if you've had a seizure or stroke or if you've had a psychiatric disorder like depression or anxiety. And what is the likelihood of recurrence? Apparently it's 4% or 1 in 25, which is a bit too high for me. So what are my takeaways from this experience? There are many. First of all, being me, I blame myself for getting so angry. And certainly I wish I had said that's a stupid email and just ignored it until I felt calmer and ready to deal with it. Although in that situation, I don't know if that would have happened. But we can't go back. We have to go forward. And I've learned now that I have to take my time and try to stay calm, especially after having it once. I certainly don't want to have it happen again. And one of the nurses in the hospital, I was telling her the story that I felt kind of guilty for having this. And she said, oh my gosh, she said it happens to all kinds of people for all kinds of reasons. People who've had their houses robbed, they've had in there. They had 2 people come into the hospital with this after the Queen died. They were grieving. Somebody who had a surprise party. And just that was the physical shock side of it. I wouldn't be surprised if that's where the term scared to death came from, because it can happen. I hope this video has been informative. I hope it's been helpful. I hope you never go through this. But if you've had a similar situation, a similar circumstance, I would love to hear about it in the comments section down below. And take care of yourself and stay well. See you in the next one.